One of the hottest accessories, it seems, on the red carpet these days is a baby bump, and it seems as if age doesn't matter for Hollywood's A-list. Jennifer Lopez gave birth to twins at age 38. Rocker Gwen Stefani was also 38 when she was pregnant with baby Zuma, and Oscar winner Cate Blanchett had her third child at 39. In the real world, though, getting pregnant, especially later in life, is not easy. So how long should couples try on their own before seeking fertility treatments? Here with some answers about this whole process is Dr. Lynn Davis from Seattle Reproductive Medicine. Dr. Lynn, may I call you Dr. Lynn?
Absolutely.
It seems like that's somewhere in between too informal and too formal. How long should a couple wait before they come in and seek some help?
Well, that's a great question. And the truth of the matter is it really depends, but for some couples, you can come in right away for an evaluation, preconception testing, or a fertility assessment. The traditional recommendation is to wait 12 months trying on your own, and hopefully you'll have a success within that period of time. But we now know that there are a lot of conditions that would lead somebody to want to come in earlier. If you're older, you shouldn't be waiting that long. Or if you have any gynecologic or medical problems, it doesn't make sense to wait.
That's what I always thought when you'd hear this 6 months or a year. Let's say you're already 36, 37, although at my age that seems ridiculous to say that's later, but later for fertility. You might want to consider at least going in for an assessment right up front, right?
Absolutely.
What's available now if you just wanted to go in and say, look, I'm going to try and I want to make sure that I'm giving myself the best chance? What's available in terms of evaluation?
So if you're ready to get pregnant, then preconception planning is always a good idea. And that includes some lifestyle factors like good nutrition and maintaining or striving for a healthy body weight, taking a prenatal vitamin with folic acid, not smoking, and keeping your alcohol and caffeine levels to a minimum. But then also going in and talking to your doctor and having some blood work testing for making sure that you're up to date on your vaccinations, and possibly some genetic screening is always a good idea, even in advance. So it's never a wrong thing to come in early
and check it out. I've been curious also about stress levels. People always talk about, well, somebody's not becoming pregnant because they're stressed, and I always think, well, maybe they're stressed because they're trying to become pregnant and not being successful. Is that really a factor?
Well, we do know that the stress axis and the reproductive axis hormonally do talk to one another in the brain, and so it can certainly play a role when the stress levels are significant. The day-to-day stress, it's hard to know, but if you do have any questions, you should just err on the side of caution and plan to come in earlier rather than later.
Let's talk about where we really are on the age spectrum. When is a woman at her peak fertility, and when do things start to become less likely to be successful?
Women are really the most fertile in their 20s, and in the best of circumstances, human reproduction is just not very efficient, and a woman is only expected to get pregnant at a rate of about 20% per cycle. And that means that once you start trying, statistically speaking, you may not be successful the first time that you try. But the good news is, over a period of time, say 3 months, then maybe 50% of women in that category would be successful. And most people do have success in 6 to 12 months, unless you're older. And we do know there's a change, usually starting in the mid-30s, so that if you've gotten to the age of 40, your baseline likelihood of success is only around 10% per cycle. And you would expect it to take much longer than about 6 months on average to conceive if you're going to.
Okay. And what do you do in your practice to address the emotional and the social issues that go along with this? What are the challenges that women face?
These are really quite significant, and at our practice we offer counseling to all of our patients because we know that fertility issues, particularly infertility, is a very stressful circumstance, and the anxiety levels and depression levels are extremely high in our patient population. So we offer counseling and support.
For individuals and for the couple?
For both.
Yeah, and people should probably take advantage of that, right? I read once that infertility patients are second only to cancer patients in how hard they will try and how far they will go to try to seek a solution, and that's got to be something that really disrupts your life as you go forward.
It can take a toll.
It really can, can't it?
Yeah.
So when it's successful, when you have a patient who actually has this dream come true, what is that like for you?
Oh, it's phenomenal. I mean, it really is very, very emotionally rewarding work, and that's why I love what I do.
Are we making progress? Are things better than they were 10 years, 20 years ago in terms of things we know in order to create successes?
Tremendous progress, actually. It's a very different age now in fertility evaluation and fertility treatment, and we have so much more to offer than we used to. And so, the big message is, if you're wondering, am I fertile? Can I get pregnant? Even if you're not ready to try, you can come in for a fertility assessment and get some more information about your own biological clock. Because not every woman ages at the same rate.
Sure.
Even
and is it important
age.
when you're coming in for that assessment to have both partners come in?
It depends. It depends on your circumstance. And we also have to remember that some women are ready to have a baby even without a partner. And that's okay too.
Right. But if you are married, should you both be evaluated?
We would love to see both partners.
That's the most effective way to
Absolutely.
go about it. All right. Well, Dr. Lynn, thank you very much. I hope everybody's successful. It's wonderful to have a baby in your life, and frustrating when you're trying and not being successful. So fingers crossed and prayers go up for everybody who's in that circumstance. Thanks.
Great.
We really appreciate it.
Thank you very much.
Seattle Reproductive Medicine can answer any questions you might have about getting pregnant. And their info is, of course, on our website, king5.com/new.